Hello everyone, welcome back to Fact Facial Assessment with Clarius Technology. I'm Dr. Roya Zarmezamin, and today's episode is about one of the very important muscle in the face, which is Depressor Anguli Oris, or DAO. DAO is very important because it becomes hyperactive during the aging and all the volume loss. It's make the face more, look like sad or tired. This muscle work with another muscle, which is DLI, Depressor Labii Inferioris, and platysma muscle. All together, they are pulled on the corner of the mouth, and that's why it's make us, look sad or tired. By treating this muscle with botulinum toxin, we can reverse this sagginess, this downward corner of the mouth, because when we relax the muscle or the elevator muscle being overact and activated to just lift the corner of the mouth. But doing treatment blind with naked eye, sometimes we don't get, most of the time we don't get the results because we scare our product linking to DLI and get the asymmetry smile and asymmetry, lips. And sometimes if we go deep, we are affecting this muscle. By superficial treatment, we don't get the result. That's why this is kind of bulky muscle in some people. It's good to scan the muscle before the treatment and target the bulkiest part of the muscle under the guide of ultrasound. Now, I'm going to scan this area. As you can see here, the bulky muscle on top in the midline is the DAO. And you can see it's almost 4 millimeter deep. And I can bring it in the midline, mark the midline in the footprint, and inject from without the guide and just going exactly the same depth. But most accurate treatment is to go under the guide, which I'm going to inject now. I use the stereo cover before I'm scanning. I disinfect the area. Now I'm going. You see my needle coming from the left side, and inside the muscle I see the needle, and I inject a little product, not too much, that's all. And my injection done. Very easy, very accurate and precise. The results gonna be perfect and avoid all the complication. Thank you for joining us for these episodes, and stay tuned for the next one.